Hello everyone, welcome back to my channel. Today I'm going to talk about the respiratory system. For those who don't know me, I'm Mohan, the student nurse, and today I'm going to talk about the anatomy of the respiratory system, and I'm going to focus on one major part of the respiratory system, and that's the nose. I'm very sure everyone knows what the nose is. And what is the respiratory system? Just from the diagram here, you can see the respiratory system consists of very many parts. We have the nasal cavity, we have the nostril, oral cavity, larynx, the right main bronchus, the right lung, the pharynx, the trachea, the left main bronchus, the left lung, and the diaphragm. All those make up the respiratory system. The respiratory system consists of the nose, pharynx, larynx, trachea, bronchi, and the lungs, all those you've seen in the previous diagram. And we find that the primary function of this system is to furnish oxygen for individual tissue cells and to take away waste products. And the waste product in play here is the carbon dioxide. And the carbon dioxide is taken away from the tissue cells that just took in oxygen. After the oxygen has been used, we find that carbon dioxide is being removed as a waste product. So, what are the functions of the respiratory system? It oversees gaseous exchange, and the gases here we have the oxygen and the carbon dioxide. So, we find that it oversees gaseous exchange between the blood and the external environment. We also find that exchange of gases takes place within the lungs in the alveoli, and we find that the alveoli is the only site within the respiratory system where gaseous exchange takes place. The other parts, let's say the trachea, the bronchi, all those are just passageways. They lead the air towards the site of gaseous exchange. Passageways to the lungs, that's the trachea, just the nose, the trachea, the bronchi. What are their functions? We find that these passageways play a very crucial function. And one of the function is that they purify the air, they also warm the air, and they also humidify the incoming air. Then another function of the respiratory system is that they share responsibility with the cardiovascular system. Without the respiratory system, we can't have a functional cardiovascular system. That's because we need oxygen for our cardiovascular system to be fully functional, and that oxygen comes from the respiratory system. So, as I said earlier, today we are going to focus only on the nose. And here's the external parts of the nose. We have the glabella, the nasal bones, the ala of the nose. All those are what makes up the external part of the nose. So we find that the external opening of the nose is the nostril, that the two holes in your nose that leads into the inner parts of the nose. Those are called the nostrils or the anterior nares. And the dividing portion between the nostril is the nasal septum, which forms two nasal cavities. Its cavity is divided into three. We have the superior conchi, we have the middle conchi, and the inferior conchi. The right, the right portion of the nose is divided into three. That's the superior, the middle, and the inferior conchi. And we also find that the left side of the nose is divided into superior, the middle, and the inferior conchi. The Conkai passages leads to the passages we called the leads to the passageway called the pharynx. And here we find that in the pharynx, the ear is connected to the sinuses, the ear through the eustachian tube, and the eyes through the nasolacrimal duct. Let's say here the pharynx is kind of a junction where the ear and the eye come together. Here is the eustachian tube. You see how it comes from the eyes and comes into the nose. That's the sorry, not the eustachian tube. The eustachian tube comes from the ear. Here's the nasolacrimal duct that comes from the eyes, and you can see how it drains into the nose. That's why you see sometimes when you cry, there's when let's say there's a time you feel like there's some fluid coming through your nose, and that doesn't mean all the fluid coming from your nose is mucus. Some of it comes from your eye, and that comes through the nasolacrimal duct. Then it's being released out through the nose. The palatine bone and the maxilla separate the nasal cavity from the mouth cavity. And we also find that the cilia lines the mucous membrane of the nasal cavity. So, what are the functions of the nose? We all know they are very basic functions, and I think all of us know what the functions are, the functions of the nose. And the first function is that it serves as an air passageway. Without the nose, let's say for example, if your nose is blocked, there's no way you're going to have a very difficult time making the air pass into your respiratory system. We also find that it warms and moistens inhaled air. Another function is that its cilia and mucous membrane trap dust, pollen, bacteria, and foreign matters from going into the alveoli. We also find that it contains the olfactory receptors. The olfactory receptors are what makes us know that this is a smell of certain thing. This is a nice smell. This is a bad smell. This is a smell of food. This is a smell of a chemical. This is a smell of all those things that you are able to smell is because of the olfactory receptors. And another function is the of the nose is that it aids in the phonation and the quality of voice. Let's say, for example, guys with let's say a simple example, try closing your nose, blocking your nose with your fingers, then try to talk. You want to be able to sound normal. And that's why the nose play a very important role in the phonation and the quality of voice. So today that's all I have for my presentation about the nose. And let's meet in my next presentation. Thank you.